All right, so in this video, we're gonna go on the adventure of talking about some bones of the leg. So right here, we're looking at stuff that will make a leg, starting with do not call it a thigh bone, but the one that is in the thigh, or the femoral region, is our femur. With our femur, we're gonna have a head, so a round structure that's for articulation, that will sit in the acetabulum, followed by the neck. After the neck, there's going to be the greater and the lesser trochanter. That is the only place in the human body where you can find trochanters, is on the femur. As you follow them, you can see a rough spot here. That's gonna be where the glute muscles attach, so gluteal tuberosity. As you keep going, it'll keep staying there, so that's also gonna be the linea aspera, where it sticks off. So linea for line, so linear. Other features as you work your way down towards the bottom of that femur is we have condyles again for rocking back and forth, kind of looks like a little rocking chair. So it will sit on the top of the tibia and kind of allow you to swing back and forth just like that to allow the knee to flex and extend. The condyles here are going to be named for what side they're on. So whenever you're working with the bones, if you're trying to figure out right from left, the best thing that you can do is first identify if you're looking at the front or the back. The front is going to be pretty smooth. Remember, the back has that long ridge, that linea aspera. The next thing is look at where it's going to plug in. So this would plug in towards the hip. So as you're sitting here and it plugs in, this is going to be the medial side. So if this is the medial side, as we come down to the bottom, if we're naming the structures at the bottom, this would be the medial condyle, this would be the lateral condyle. We have the rough spots above the condyle, so we'll have the epicondyle on the medial epicondyle, and then the epicondyle on the lateral side, so the lateral epicondyle. Those will articulate with the condyles of the tibia. So we have the same setup. At the top of the tibia, you have condyles, medial, and lateral. You're also going to have a fun little floating bone that's going to hang out with all of this called the patella. With that patella, you're going to merge some of the tendons from the muscles here to it, and then you're going to have another connector point, a ligament, that's going to go from the patella right here to this rough spot on the tibia. So this is going to be the tibial tuberosity. So tibial tuberosity here is going to help you also landmark if you're looking at front or back for this bone. So this is the anterior surface. The back side has a more of a concave look to it. As we look at the bottom here, we're going to have two bones that are hanging out next to each other. So tibia is the big one. It's going to be more medial. Think about where you put your weight. It's going to be in the center of your body. So we're going to have the heavier bone on the inside. On the outside, we will have this little guy right here called the fibula. So the trick I use is tibia is the big bone for the lower leg, and then the fibula is a little bone. So I think of like fibs or little lies, the fibula will be the little bone. The fibula at the top will have a head, which will tuck up underneath the tibia. And at the bottom, we're going to have malleoli. So not styluses like we saw up in the radius and ulna. These are different. They have different terminology. We have a medial malleolus, because remember the tibia sits medial, and we have a lateral malleolus for the fibula. Now, another thing to make note of is the fact that the lateral malleolus reaches down further than the medial one. Go ahead and feel your ankle. You should notice that. So if you're looking at an injury and somebody rolls an ankle, typically most people roll their ankle towards the inside, or a medial move. We call that inversion. But if there's an eversion and they roll their foot to the outside, typically they will also break the fibula. All right, thanks for learning about the leg.